Good afternoon. This is Dr. Shabinsky. We're going to be doing some scenarios. We're going to do 3 scenarios, and then we're going to go ahead and go over those scenarios, and then we're going to do a little bit of an educational session going forward. All right?
Perfect.
So your first patient's a 37-year-old woman who comes to see you because she noted blood on her bra a few times over the past 3 months. She noted it on the right side only. It was not induced, it was spontaneous. And she has a history of menarche at age 12. Her last period was 2 weeks ago. Gravida 3, Para 3. She used birth control pills for 10 years and has an IUD in place currently. Her sister had breast cancer at the age of 40. And as I said, the blood was dark and spontaneous.
Okay. I would go ahead and examine her.
Okay. The exam is unremarkable, with the exception as you palpate the right breast at the 3 o'clock position, you see some bloody discharge.
Okay. I would go ahead and explain to her that a bloody discharge would be worrisome for a possible malignancy, and I would like to do some imaging studies on her, taking also into consideration that she has a family history of breast cancer at a young age. So I would order the breast mammography and also ultrasound.
Okay. And there you see her mammogram, and there you see her ultrasound. And there's a blow up of her ultrasound with imaging.
Okay. It looks like she might be having an intraductal papilloma. Is there any further recommendation for an MRI from our radiologists in the report?
Radiology suggests perhaps additional imaging with an MRI and or biopsy may be helpful.
Yes, I would order an MRI. And if there is no additional finding, I would go ahead and ask for an ultrasound guided biopsy to the lesion.
Okay, and there's your MRI.
Yeah, I would like the radiology team to do an ultrasound guided biopsy to the lesion.
And the biopsy shows an intraductal papilloma, partially excised with the needle, and there's no atypia.
Okay. So I would bring the patient back to the clinic and explain to her that if there is no atypia, the likelihood of the diagnosis advancing to a malignancy is low, about 2%. And I would recommend her to be followed first with 6-month short interval imaging, and also a physical exam, and go from there.
Okay. Even if the papilloma was 1.5 centimeters?
1.5 centimeters, still no atypia, I would leave it in place.
2 centimeters?
Is the radiologist, do they think that is concordant with the pathology result, the imaging finding?
Well, it's concordant, but